Yes, we are live now.
Yeah.
You can start.
So very good evening to all the students who are watching us live. So first of all, let me introduce myself. I am Dr. Rohith Daniel, the orthopedics faculty at Doc Tutorials. And today we'll be conducting a very interesting session where we'll be comparing general surgery and orthopedics as career options for you. And in order to discuss this further, we have a very eminent faculty with us, probably the best surgery faculty. Rajamahendran sir. Sir, welcome to the discussion. And sir will be sharing his opinions about general surgery from his vast experience and knowledge. So just at the outset, I will just tell you that we'll be discussing these things in 5 points. First of all, we'll be discussing about the pros of both these specialties, then the cons. Third, how the junior residency would be in both these specialties. Fourth, what will be the job opportunities once you have finished with these MS courses. And finally, what would be the future opportunities. Now, before going into each of these, I would first like to invite Dr. Rajamahendran sir to speak a few words about which kind of students should take up a surgical specialty, be it general surgery or orthopedics, both are surgery only. So which kind of students should take up surgery and which kind of students should not, sir?
Hello, Dr. Rohith. Thank you for the introduction. First of all, we have to introduce, we both are practicing surgeons because many programs are going in online. Most of them are actually not practicing. Many of them who are guiding the students, actually they are not into practice. Dr. Rohith is having his own hospital. He's having many consultants along with them. So he has a good knowledge about what is happening outside. Many online programs which are done for similar counseling guidance program, I could see the faculties who are actually talking about these career guidance, actually they don't do practice. They're only faculties. So here, one important thing what we are doing in Doc Tutorials is, Doc Tutorials, we are doing career guidance program by the practicing faculties. Dr. Rohith is a practicing orthopedician. I am a practicing surgical gastroenterologist, and day to day we see patients, complications, management of various complicated cases, everything we are seeing day to day. And first of all, as Dr. Rohith said, surgical field is one important field which you should have a huge passion before selecting any surgical field, like let it be a surgery or let it be orthopedics, let it be ENT, ophthalm, OBG, all these are surgical fields. You must have a huge patient. Not like you cannot develop a patient like in other specialties, like in radiology, dermatology, medicine and all. You can develop patient as you go on. But surgical field, you should have a long run patient towards the surgical specialty before selecting surgical specialty. You might have a dilemma in going for which specialty. That is why we are comparing surgery with OBG, surgery with orthopedics. And this is a very common question among male PG aspirants, whether to go for surgery or orthopedics. So let us start the discussion, Dr. Rohith sir. Let us start with the pros in surgery. Let me tell what are the positive factors in surgery. Yes. So as you know very well, once upon a time, ortho is an end specialty. But from the beginning, surgery is not an end specialty. So always, when we go for surgery, we have a huge plan whether to go for urology, surgical, gastro, onco surgery before itself. So when you see now, surgical field has expanded to an enormous amount. Now we have more than 20 super specialty courses. And after that super specialty, we have more than 40 to 50 fellowship courses available in surgery. So surgical field has a huge opening in practice. So if you see, compared to any other specialty, the fastest growing field is general surgery, followed by super specialty fields. So definitely those who are interested in surgery, you will see enormous miracles once you join into surgical field. You will get a specific interest into some surgery, maybe a neurosurgery or a cardiothoracic surgery, something you will get into specific interest and you will become a leading practitioner in future. So these are the pros in surgery. I can say pros in surgery, for example, as a gastroenterologist, you can see 5 years, 8 years back, nobody knows what is robotic surgery. Now, most of the surgeries, neurosurgery, oncosurgery, gastrosurgery, everything is done by robotic surgery, which makes the hands of a surgeon very free and makes us comfortable for long run practice. That is the pros we have in surgery. So can you tell me what are the pros in orthopedics, Dr. Rohith?
Yes. So if you look at orthopedics, first and foremost, the greatest advantage is that it is an end specialty. See, as you sir said, after general surgery, you will have to definitely spend 3 more years if you have to do a super specialization. But as far as orthopedics is concerned, you don't need that. Even if you want to do a fellowship or something like that, it is maximum of 1 year or at the most 2 years. So even if you want to do a fellowship. even if you don't do a fellowship also, you can easily get a job. You can practice as an orthopedic surgeon in any hospital you want. So that is one big advantage of orthopedics. So if there is any student who wants to complete his course as fast as possible and start earning for his family, so this is a better option, I would say. Second, orthopedics is not a very saturated field as many other specialties. So I was just looking at the number of orthopedicians in India. So as of now, we have around 15,000 orthopedicians for the whole of India. So that is not a big number at all. So we need a lot more orthopedicians. So may not be in tier 1 cities. If you go to a tier 2 or to a periphery, then always there is an increased demand of orthopedic surgeons. Third, the patient numbers in orthopedics are also slowly increasing. Why? Because our population is aging, isn't it? So as our age increases, there will be osteoarthritis, osteoporosis, all those problems are coming in. We are seeing more and more number of hemiarthroplasties, intertrochanteric fractures, spine fractures needing surgeries. We need more and more total knee replacement and total hip replacements. So for all these things, we need orthopedic surgeons. So again, our demand is slowly going on increasing. And fourthly, I have to say that the remunerations as a young orthopedic surgeon is usually a little bit higher than the other specialties if you compare. If you are planning to join a small hospital in a tier 3 cities, then you can expect upwards of 1 lakh or 1.25, 1.5 lakhs even, but it should be in a periphery. So that is also possible. And finally, orthopedics is a very, very interesting field. As Sir said just now, even in orthopedics, we have arthroscopy, minimally invasive spine surgery coming in. Then we have robotic assisted surgeries. Even now, TKR and all are being done regularly with the assistance of robots. So all these things are advancing at a very fast pace. So if you want to be at the cutting edge of science, medical science, then orthopedics could be a choice for you. So these were the pros as far as orthopedics are concerned. So now let's discuss the cons of the various specialties. Again, sir, I would like to ask you regarding your experience. What are the cons as a practicing surgeon of general surgery?
Yes, the cons actually, when you go for surgery, the delayed settlement is the only cons. Actually, if I can say, you will have a latent period of at least 10 years after joining MS general surgery. From the day of joining MS general surgery, it will take 10 years minimum to start a good practice. But once you complete your super specialty, the income will be much better compared to any other specialties, including orthopedics. The super specialty income is minimum 4 to 5 lakhs in any corporate hospital itself for most of the centers, and minimum 3 lakhs if you even start your own practice. That is one important thing in super specialty. But the problem is, it is a long run. You have to wait for 10 years to see huge amounts. And the complications, I will always say, compared to orthopedics, general surgery, super specialty complications are high. For example, in orthopedics, the maximum complication they will get will be infection of the implant, or very rarely, 1 in 1,000, they may get a fat embolism or some other complication. But general surgery is not, general surgery or any super specialty, the complications are life endangering. So we used to see surgical gastro case, or even onco surgery case, or whatever the case we are doing, the mortality is always there in a surgical field. That mortality may not be there in orthopedics, and mortality in orthopedics are most of the time accepted in many issues, because most of their patients are trauma patients. So most trauma patients they are dealing, but they will accept. But in our situation, we are not dealing a trauma patient. We are dealing with a cold case, which is who comes to our hospital by walking. So when something happens, we are in little trouble compared to other specialties. So therefore, some surgeons, after finishing MS general surgery, they are moving on to specialties which have less medical legal, which less stress. Like, for example, they go to plastic surgery, they go on to some other fellowships, like things they move on instead of going into super specialty like gastro or onco surgery is also there. That is the only cons I can say in surgical fields. Otherwise, I don't think any cons in surgical field compared to any other field. The super specialty surgeons earn much better than any other specialty in all over the country. So I have my friends who earn 10 lakhs minimum per month to even 30 lakhs, 40 lakhs per month. There are my friends who are earning in different places. So that is all depends upon how further we go on in the fellowships and other training in the specialty. Yes.
Yes. Well said. Sir, if you look at the cons in orthopedics, first and foremost, there is a learning curve. See, orthopedic surgeries are not very easy. Even if you look at the fracture, it is a small fracture, but it may not be very easy to reduce and fix. So unless you are learning it, surgery, orthopedics in a very good institute with a high patient volume, you may not get enough hands-on experience. So that is something that you need to keep in mind. Always choose an institute where you have adequate patient load. And if you're not able to do that, after completing your 3 years MS course, make sure you do at least 1 or 2 years of senior residency in a high volume center. That will help you a lot. That is one thing. Second, as sir said, there is a huge baking period. My HOD used to tell me that our cake bakes in 10 years. Exactly that's what sir said. So when I started my practice 7 years ago, I remember my first day in OP, I had 3 patients. The first month, I had a total patient load of 100 patients. And now it's 60 patients every day. So it takes around 7 or 8 or 9, 10 years for you to build up your career. So this is a long journey. Initially, your remuneration may not be that high, but slowly over a period of time, it will exponentially grow. That is one thing. The third is there is night duty in orthopedics. Our day starts at night. That is the truth. Because remember, all the trauma, everything occurs at night after 7 o'clock. People drink and drive, people sleep at the wheel. Elderly patient, after sleeping, go to the toilet to take a pee, they fall down, get a fracture and come. All these things happen only at night. So unless you are ready to take hectic night duties, please don't come to orthopedics. Hectic night duties are a part and parcel of orthopedics. That is one thing. And then a very important point is that your dependence on other specialties and a big hospital. So if you want to work as a full-fledged orthopedic surgeon, doing all kinds of complicated surgeries, then you need to attach yourself to a big hospital where there is a blood bank, there is a good anesthesia backup, there is a cardiologist. All these specialties are required. And by extension to that point is that if you are planning to set up on your own, then it is going to be very difficult as an orthopedic surgeon because the investment that you need is quite high. I know this because recently we had a renovation in our hospital where we had renovated our surgery theater and the ortho theater. The amount we spent on the ortho theater was 2.5 times more than the general surgery theater because of all the paraphernalia, the lead covering, everything that comes into an orthopedic theater is going to be very expensive. That is one thing. And finally, one small point is that you cannot hide your mistakes in orthopedics because X-rays are available everywhere. If you don't correctly reduce a fracture and fix it, anyone can take an X-ray and see that, oh, there is a gap in my fracture. Sir has put a screw inside my fracture. Sir has put a screw inside my knee. Things are possible. So whenever you are an orthopedician, make sure that you fix a fracture towards 100%. That's all. So these are, I think, the relative cons, I would say. So with that in mind, let's go on to the next part. That is, how is the junior residency in both these specialities? We'll start with Rajamahendran sir again. Sir.
Actually, I don't think there is a separate discussion on junior residency. Both surgery or ortho, both surgical fields. First year residency is really tough. First year residency will be 10 times tougher than a CRMI period. Like internship will be much better than a first year PG. So definitely you have to be suffering so much in the first year post-graduation period. Second year, third year are little comfortable. Third year is more comfortable in surgical field. I don't think first year you have to suffer, no other way. Because it is the naturally formed protocol for many years. First year PG will be doing all the ward work, right? From A to Z, everything will be done by a first year PG. Second year PG, he gets relaxed. He goes for a special posting outside. He'll be roaming outside for all the special posting. Third year, they will be coming back to the ward like an assistant professor. Third year, PGs are more or less like a junior most assistant professor of the department. So comparatively, I will say only for 1 year, you have to suffer very much in general surgery period. You have to withstand that stress for that 1 year. If you are going to withstand that stress for 1 year, so in your lifetime, you will never see any such stress. That is a maximum stress you'll see in first year. You have to be prepared for that. I have so many of my friends who discontinued within 2 months of joining general surgery, 3 months of joining general surgery. I told them, you just wait for 6 more months. Everything will be changed within 1 year. First 1 year, if you are going to suffer too much, you are going to enjoy the next 2 years. If you're not ready to suffer for the first 1 year, definitely the next 2 years are going to be so much stressful for you. The professors will not give you any chance and you will be getting all sort of issues in the second and third year. So I think this will be the same in orthopedics also. What about orthopedics, sir?
Yes, very, very true. I'll just tell my story here. So when I joined orthopedics, I never expected it to be so hectic. So when I joined orthopedics first year, I joined at 80 kilogram. By the end of 6 months, I was 71 kg. I lost 9 kgs. And at the end of 9 kgs, I called my mother and said, I don't think I can't continue here anymore. And I want to come back. And my mother said, okay, if you can't, you come back. Then I said, okay, then let me just try one more month. And within the next month, I was able to do 2-3 surgeries, small surgeries, patelectomy, patellar fixation and all that. That changed the thing for me. Then the interest for the subject grew on me. And then after that, it was great. So as sir said, the first year is going to be very hectic. It is going to be like military academy for you. The first year, if you go through, then that is it. Then the rest of your life is easy. Okay, sir. So with that, let's discuss about the job opportunities after general surgery, sir. What do you think about it?
After general surgery, as of now, I will say the job opportunities are very minimal. After MS general surgery, with MS general surgery, the job opportunities, for example, we have so many private medical colleges around us. The salary package in a private medical college around me is around 70,000 to 75,000 only per month. If you join into government service, the salary is around 90,000. But the problem is there is no vacancy in government service. In government service, there is no vacancy for MS general surgery. In private institutes, there are vacancies, but very low pay are only 70,000 to 80,000. Even if you start your own practice in a general surgery, it will take at least 1 to 2 years to even see 1 lakh per month. So therefore, initial few years of job opportunity is very less in general surgery. It is always better to go immediately after finishing MS general surgery. You should go on to super specialty. Once you go for super specialty, the super specialty job vacancies are college. The salary for a MCH pediatric surgeon or a plastic surgeon is around 2.2 lakhs plus, and the same corporate hospitals are taking nowadays. You can see many corporate hospitals, they don't take MD graduates or MS graduates. They take only super specialty graduates. So for example, there is a 𝗀𝗿𝗄𝗧 hospital here. So in 𝗀𝗿𝗄𝗧 hospital, all the specialty people are only taken. They are not taking any general surgeon or general medicine. They are looking for people who have had special fellowships or special training. So job opportunity, you can get enormous job opportunity after finishing super specialty. After general surgery, very long time you have to wait for getting a good income. So I always say, if you are going to take MS general surgery, come with a plan with a super specialty. Don't try to end up your career with MS general surgery. It is very impossible to get a good income in future. So you will develop an interest in one specialty. You have to go with that. Yes.
That's a great point, sir.
Your job opportunity in orthopedics, sir. How is the job opportunity presently outside?
As till now, there is no need for a super specialization or a fellowship as of now for getting a good job in orthopedics. But situation is slowly changing because there is a need for more and more arthroplasty surgeons. We need more and more spine surgeons, pediatric orthopedic surgeons, and arthroscopy surgeons. So there is a demand for these kinds of specializations. So people are going for fellowship. I myself did a fellowship in sports medicine and arthroscopy. So this is a need at the moment. So even though you don't have to spend about 3 years doing a super specialization, you might have to do at least 1 year of fellowship in a subject of your choice. Maybe spine, maybe arthroplasty, maybe arthroscopy, whatever it may be. You may have to do that. But I think if you are entering into a private medical college or a corporate hospital, you can expect from 75 to 90,000 when you start out. But if you are going to a periphery where there may be at least only around 4 or 5 orthopedicians around, in that scenario, you can earn up to 1.5 lakhs. So that is also possible. But generation at the beginning is not what counts. Once you build up your practice and once the number of patients coming to you increases, once the patients start trusting you, that is when your income is going to grow exponentially. Isn't it, sir?
Thank you, Dr. Rohith. Thank you so much.
And finally, a point regarding the future prospects. What do you think about the future prospects of general surgery and
any surgical field? The future prospects are excellent because this is the fastest growing field. As I already told you, now surgical field is the fastest growing field compared to any other field. So even as a surgeon, I'm seeing what I'm seeing 3 years back, the treatment, everything is going completely changing within 3 years. So many new interventions are coming. Energy device, just take a simple energy device. We were using diathermy when I'm doing MS surgery. After that came a harmonic. Now there is 𝗥𝗷𝗵𝗵𝗃𝗂𝗃, lasers, etc. So many gadgets are coming up in surgery, and surgery is one of the fastest growing field, and you should be ready to learn surgery until your last day of practice. That is very important. The future prospectus will be good as long as you are going to get updated with the latest treatment protocols. That's what I feel, sir. About orthopedics,
exactly the same in orthopedics. Orthopedics is also evolving very fast. There are newer and newer implants coming in on a regular basis. The arthroplasty implants, the meniscus fixation devices, rotator cuff tear repair devices, all are changing every 1 year or sometimes 2 years. So, and the advent of robotics has also changed orthopedics to a great deal. I think probably after urology surgeries, probably in orthopedics is where robots are maximally utilized. So again, as in any other specialty, you will have to be at the cutting edge of science. You will have to update yourselves on a regular basis to be relevant for your work.
Yes, sir. What is the final word related to orthopedics? So those are
1 second, sir. There are a few questions that have come up on chat. So can I ask a few of those?
Please ask the question, sir.
So there is a question asking if general surgery or orthopedic residency is good, is possible if the person has mild essential tremors.
Sir, actually, there are 3 questions very commonly asked every year during counseling. That is, one is related to tremors. And second is related to color blindness. Third is related to some cervical spine problem. So if the patients, some of our medicos having spine problem. See, having a spine issue or having a color blindness or having a tremors, this 3 is an issue or not cannot be answered by surgeons. You have to consult the concerned specialist. For example, you should meet a neurologist for a tremors. Color blindness, because I had one of my friend with a color blindness, he used to operate extraordinarily. He will be calling me only for one thing, that is to see the color of the drain coming out. He will be asking whether it is a blood or bile. That is the only time he will call. Otherwise, he does extraordinary surgery. So color blindness may not be an issue. I have seen practically people with color blindness operating, but you have to get it clarified from ophthalmologist. And spine related issues, whether you can stand for a long time. If you have any spine related problems, you should consult orthopedician, whether you are suitable for a surgical field. So these questions cannot be answered by surgeons. So you have to get the answers from the concerned specialist. I feel like that. So tremors, if you have, robot is there, which will eliminate whatever tremors you have in future. That is one thing I can tell as an MCQ as well as an answer. So you have to consult a neurologist before taking general surgery.
Okay.
Any other question?
There is another question about orthopedics for a female candidate. There is no gender bias in orthopedics. I grant it to you that the number of females coming into orthopedics is less, but there is nothing that in orthopedics that a female can do. Whatever a male PG can do, a female PG can also do. But only thing is that one, there are lots of night duties, so you may have to adjust to that. Second, the thing is that it is a little bit of physical. There is a little bit of physical element to it, especially when you are reducing fractures, or especially when you are doing a surgery on big bones such as femur and all. When you have a 6'5" patient with huge femurs, and even I find it difficult to reduce. So these are the only rare situations where the physicality of it comes into play. Maybe you can ask the help of your assistant in those situations. That is all. Now, the second important thing is pediatric orthopedics is a wide open goalpost for all female orthopedicians. I know many female orthopedicians who, after completing their PGs, go in for pediatric orthopedics. We have Dr. 𝗥𝗷𝗵𝗵𝗃 in CMC Vellore, probably the most eminent pediatric orthopedics in the whole of the world. So she is also a female. Many students, female PGs working with her as well. So there is nothing that prevents a female from doing ortho PG. Nothing like that.
Okay, sir. Okay. Yes, sir. Any other questions, sir, from the students?
Sir, another question related to surgery. Sir, is DNP surgery worth it if I am doing it from a private institution?
Sir, as I told you, only the one which you are going to practice is finally the super specialty thing. See, for example, I was doing CA breast, thyroid and a lot of surgeries some five years back before doing my MCH. But once I went into MCH, those cases will never come to me. So whatever you are going to do in your super specialty is a matter thing. So therefore, you don't worry about where you are going to do MS surgery or DNP surgery. Go with the good concepts, come with the basic skills. Definitely, you are going to learn everything in the super specialty, and you're going to only practice that super specialty in future. So don't worry about wherever you are going to study. If you are interested in surgery, take wherever you get.
So there is a question about 6-year neurosurgery course.
So there are direct neurosurgery courses. I always say don't take. If you are able to take general surgery, take general surgery, and then you can go for neurosurgery if you want. Because I have seen some of the students who went into direct neurosurgery, direct cardiothoracic surgery, direct pediatric surgery, they started hating the course after a few years. So it is like living in a same home for more than 6 years. Most of us, we don't like to live in the same place for 6 years. We would like to change the room setup, etc. No? So sometimes you might hate the course. Therefore, if you finish MS general surgery, super specialty entrance examination is not so tough like this PG entrance exam. If you write, definitely you'll get 70%, 80% chances of getting a super specialty. So you can easily join super specialty at that time. So don't go for super specialty direct courses if you are able to get MS general surgery or DNP surgery in some place. So after finishing this, you can easily enter into super specialty by writing an entrance exam. That is more easier than NEET PG exam. Don't worry.
Another question, if someone has DVT, is that a contraindication for becoming a surgeon?
Better not to take, sir, because DVT is progressive. So better not to, because we have to have a long time standing. So better not to take, because there are so many other courses where you can do the job by sitting and relaxing. Better not to take with such a DVT related issues.
So there is another question. People say that ortho is more saturated than surgery. Is that a concern? See, whatever specialty you see, the number of these specialists would be less than 20 or 25,000. See, the population of the country is 1.3 billion. So there is a long way to go. The only problem is that people flocking to the tier 1 cities or tier 2 cities. If you are willing to go to a little bit periphery, you can establish yourself. You can earn a lot of money without much problems at all. So there is no problems in scope or job opportunities at all. You just need to be willing to be to go to a little bit more peripheral area. That is all.
Okay, sir. I think the final
one question also here about opportunities after MRCS. Can you?
Sir, MRCS is a course which is actually foreign degree from Royal College. So if you are going to practice in India, this degree is not needed. For MRCS degree is 100% not needed in India. They are not valuing this degree in any medical college, or even medical council will not value this degree. So only you can put you have a foreign degree and you can have an extra edge during your private practice. But definitely MRCS has an extraordinary value when you're going to go for Arab countries, or you're planning to go for UK. These places, MRCS is having a huge value. I also completed MRCS because all my friends are doing MRCS. I also completed MRCS during my MS period. But following MRCS, I spent around 2 lakhs to 2.5 lakhs for the exam fees, etc. And we have to do registration every year. We have to do the membership fees, 30,000, 40,000 from those days. So I was paying that membership fees for 3-4 days, and 3-4 years I was paying. After that, I felt I'm not going to go for abroad. I'm not going to go for any Arab countries. What is the use of holding this degree? And once you are not paying that fees, you cannot use the degree at all. So therefore, from 2010, my degree, they have mailed me, you should not use this degree hereafter in your name because you have not paid the subscription fees. So I felt this is like a looting from the surgeons who is not at all coming to UK. When I'm going to come for UK, definitely I'm going to use this degree. I'm not going to UK, I'm not going to Arab countries, and I'm not going to get any extra payment in my government hospital because I have finished an MRCS. So if you are going to do practice in India, definitely MRCS is 0% use. If you are going for abroad, it is 100% useful. So you have to decide whether you are going to be in India or going to be going for abroad. So definitely at that time, you can decide. So don't worry about MRCS now. Complete MS surgery, MRCS, you can finish any time after. When you're going for UK, at that time, you can finish in 6 months. That is not an issue. Okay. Yes, sir.
I think that's it, sir. So I would like you to mention the final words, so to say.
The only final word
can you give it to our students?
Final word to take surgery is take surgery only when you have huge interest and passion towards surgery. Don't take it because it is available at 10,000 rank or 11,000 rank, and general medicine is not available at 10,000 rank. So I'm going for surgery. This is a wrong option. I have seen so many students who discontinued surgery, who had interest in medicine and joined surgery. They could not withstand the surgical stress and they discontinued. If you can't take general medicine and you are interested in medical field, go to MD anesthesia. That will be much better option. Or emergency medicine. That will be also available behind surgery. So don't take surgery because it is available. You take it only if you have loved this course and you had a huge dream of becoming a surgeon for so long period. That is our only request from me, and follow this request. Yes, what about orthopedics, sir? Your final word related to orthopedics, people taking orthopedics.
Orthopedics is a little bit hectic. If you have no problem with that, if you want to have a little bit of fun after surgeries and all, then orthopedics is the way to go, because orthopedic community is a fun-loving community, so to say. We all meet together very often, and we are a tightly knit community. So if you want to join this tightly knit community, you are all welcome to do so. That's it, sir.
Thank you, sir. Thank you for an extraordinary session.
Thank you, sir.
So the students would have got a clarity related to whether to take surgery or ortho. So thank you, sir. Thank you all, friends. We will meet in another session soon.
Okay. So if you have any further doubts, you can just put your messages in the comment section of this video. We'll clear it there. Okay. So thanks again.
Thank you, sir. Thank you.
Bye, sir. Thank you.
Bye.
Good night, everyone.
Good night.
Completing the NEET PG syllabus can be challenging. Doc Tutorials presents NEET PG 2025 Live Power Pack. Whether you are at home, college, hostel, or library, our live classes will be right on your screen. Simplify complex topics into easily understandable concepts and prepare all 19 subjects effortlessly with our expert guidance. Our NEET PG 2025 Live Power Pack offers live classes for complete coverage of all 19 subjects, 19 tests and discussions, full access to NEET PG Power Pack, quick revision program, recorded sessions for reference, hard copy workbook based classes, post-session tests, and grand tests and subject tests. Our eminent faculty. NEET PG 2025 Live Power Pack, bringing classrooms to your doorstep. Enroll now.